My name is Susie Baum, and I am a patient of Oral and Facial Surgeons of Arizona. I was referred to Dr. Golding because I had 2 implants that had failed and I needed to have corrective surgery. So I had the implants done at 2 different times. Each time it was because I had a crown and a root canal that had failed. So by a different office, not from Dr. Golding's office, I was starting to have issues with my gum, and I had an abrasion in my upper gum that didn't seem normal to me. So I went back to the person or the dentist that had put in the implant, and for like 9 months he had me coming back and it was getting worse. And I started to get ill, actually, with a terrible cough and a fever on and off, and I would keep going to my internist, who said to me, "Are you having any issues with your dental health?" And I said, "As a matter of fact, I am." And he said, "I want you to go see somebody else for a consultation." So I went to somebody unrelated that he sent me to for a consultation, who told me that both of my implants were failing and that I needed to get them out of my mouth immediately, at which point I was referred to Dr. Golding in his office. I've had to have 2 reconstructive surgeries, and I was a little apprehensive, as you can imagine, for the first one. I've had an extremely challenging dental history. And so when I went to see Dr. Golding initially, he reassured me that he would answer all of my questions and make me feel completely confident in whatever procedure we were going to go ahead with, which was great because I wanted to make sure that we had the best possible outcome. I was very pleased with the outcome of the surgery, and I also was very educated about what was going to happen post-surgery, so I knew what to expect. And Dr. Golding actually followed up with me the night of the surgery to make sure that I was doing okay, and then the office followed up with me. I think that I was very well prepared because I feel like everybody that works in the office is part of a team, and they made sure that the information that I have answered all the questions that I had. So I think that I just felt great from everybody that was involved. I think that was most important was that he partnered with me in wanting to have a good outcome. Any question I had, as ridiculous as I might have thought it was, he was happy to answer, because he understood that in order to have a good outcome on the procedures, that we both needed to be on the same page, and I needed to be confident in his ability to carry out what he said he was going to do. Absolutely, I would recommend them 110%. The office doesn't merchandise you in terms of trying to add on additional procedures or something that would be financially profitable for them, but not necessary for the patient.